What is the normal central venous pressure CVP? Answer is 5 to 10 centimeters H2O. Which electrolyte imbalance commonly causes peaked T waves on ECG? Hyperkalemia. Which artery is commonly used for ABG sampling? Radial artery. The first priority in ICU nursing is airway management. Which ventilator mode allows spontaneous breathing? SIMV. Normal SPEP-O2 value is 95 to 100%. Glasgow Coma Scale assesses level of consciousness. Normal urine output in adults is 30 to 50 ml/hr. Patient with tension pneumothorax requires needle decompression. Which drug is commonly used during cardiac arrest? Epinephrine. Normal ICP is 5 to 15 milliliters of mercury. Which electrolyte is most important in cardiac rhythm? Potassium. The normal pH of arterial blood is 7.35 to 7.45. Which condition requires isolation in ICU? Pulmonary tuberculosis. Which IV fluid is isotonic? (0.9%) normal saline. Which ECG change indicates myocardial infarction? Sext XT elevation. The normal respiratory rate in adults is 12 to 20 min. Which medication is used to reduce intracranial pressure? Mannitol. Best position for unconscious patient. Lateral recovery position. Which electrolyte causes muscle weakness when low? Potassium. Normal adult heart rate. (60 to 100 BPM). Which organ is most affected in septic shock? Kidneys. First sign of hypoxia. Restlessness. Best indicator of tissue perfusion. Urine output, which is a vasopressor. Norepinephrine. Normal PaO. (80 to 100 mmHg), which ABG value indicates acidosis. pH 7.25, which is the most common ICU infection. Ventilator-associated pneumonia. Defibrillation is used for ventricular fibrillation. Normal MAP should be 65 milliliters of mercury. Which score predicts pressure ulcer risk? Braden scale. Which electrolyte imbalance causes tetany? Hypocalcemia. Normal serum sodium. (135 to 145 MAQL). Best method to prevent VAP. Head elevation 30 to 45. CPR compression depth in adults. (5 to 6 centimeters). Normal serum potassium. (3.5 to 5.0 MEQL). Which drug reverses opioid overdose? Naloxone, which is a sign of increased ICP. Projectile vomiting. 8 ET tube placement is confirmed by capnography, ETCO2, normal PaCO2, (35 to 45 mEg). Which drug is an anticoagulant? Heparin. Which rhythm requires immediate CPR? Asystole. Most common cause of shock. Hypovolemia. Normal capillary refill time. less than 2 seconds, which is a high alert medication in ICU. Insulin. Best site for pulse check during CPR. Carotid, which ABG indicates respiratory acidosis. pH 7.25, PaCO2 55 milliliters of mercury, which monitor detects oxygen saturation. Pulse oximeter. Which ICU emergency needs immediate epinephrine, IM? Anaphylaxis. The most important nursing responsibility in ICU is continuous patient assessment and monitoring. Thanks for watching. Like and subscribe for more videos.